Hi, it's Dr. Greg Mendel, your friendly anatomy professor. We're going to go over parts of the skeleton. So let's come over and we're going to start with upper extremity. So when we look at the upper extremity, the first thing we're going to start with is the shoulder girdle and the upper extremity here. And so the first thing we look at is the clavicle. When we look at the clavicle, we see that there is a medial and a lateral aspect to that. The medial aspect of the clavicle is meeting up with the sternum, the manubrium. So we have the claviculosternal joint here. The clavicle comes out and has an S-type shape, and we see that it meets up here with the acromion process, forming the acromioclavicular joint here at the clavicle. We're going to turn this around and look at the scapula. When we look at the scapula, we see it first of all from the posterior view. There's some parts we need to go over. First, we see the spine of the scapula going across here. And above the spine, in this space above it, that is called the supraspinous fossa. Underneath, it's the infraspinous fossa. Under the scapula is called the subscapular fossa, so on the inside or underneath it, subscapular fossa. We have the superior angle of the scapula, the inferior angle of the scapula, the medial border of the scapula, the lateral border of the scapula. Where the humeral head meets up with the scapula, that part is called the glenoid fossa. So where the humeral head and the fossa meet, glenoid fossa or glenoid cavity. This is the acromion or acromion process. In front we have the coracoid process. So the long-headed bicep will be connecting onto this. So let's talk about the humerus. As we see the humerus, where it attaches here first at the glenoid cavity. I'm going to switch and grab an arm that is already disarticulated a little bit easier. If you could come over here with the camera, we'll just look here so everybody can see the parts of this real well. So we're looking at the humerus, and we're laying it basically in an upright position. And so we see that this is the head of the humerus. When you look at the head of the humerus, we could follow that around and see that there's a definitive line that breaks up the head of the humerus from the rest of the humerus. So it's called the anatomical neck of the humerus. This would be the surgical neck. So if a surgeon just cut the head of the humerus off, that's the surgical neck. When we look at the humerus, you can see that there are two big bumps here. These are called the greater and lesser tubercles, and we have an intertubercular sulcus going down between them. So the greater tubercle here and the lesser here, these go anteriorly. So if you look at it from the posterior view, you won't really see them. Lateral, and one of the markings on the side of the humerus that most people have tagged in lab practicals, is this blue area, and what that is, the insertion for the deltoid, and that's called the deltoid tuberosity. And so this is the epiphysis, the diaphysis of this bone, and down at the end another epiphysis. Let's zoom in close so we can look at the elbow, and the parts of the elbow is where they meet. When we look at the elbow, and we're looking at the distal aspect of the humerus, where the elbow meets, we first see the outside parts of this humerus, and there's basically a bump on each side, here and here. When we look at it, one of the things we want to orient ourselves with is which one's medial and lateral. And we see the head of the humerus going this direction, and you never have the head of the humerus connecting outside the body, so this has to be medial, and that makes this the medial epicondyle here. The lateral epicondyle would be here. If you can look in close, you can see that there's this flattened surface where these bones meet together. That's called the trochlea. The trochlea meets up with the ulnar bone, and there's a groove in the ulna, or the ulna, where the trochlea fits, and that's called the trochlear notch. If we look in the front, we can see this part sticking up in front of the elbow, and that's called the coronoid process. Now the coronoid basically comes up and fits in this little groove in the humerus, and that is the coronoid fossa. If we flip it over and look at the ulna, if our elbow hits the table, we bump our funny bone there, and so there's a name for this tip of the ulna here, and that is called the olecranon. process, or just the olecranon. And the olecranon comes up in, and when we have full extension of the arm, there's like a little groove in the back of the humerus where the olecranon fits, and that is the olecranon fossa. So we have the trochlea, the trochlear notch, the coracoid, which fits in the coracoid fossa, the olecranon, which fits in the olecranon fossa. Now that's on the ulnar side of the elbow. Now, when you look at the ulna, the head of the ulna is down at the wrist. It doesn't have nearly the attachment to the hand as the radius does. The radius has the most of the attachment to the hand or wrist, but its head is up here. The head being on the opposite end of where they're mostly attached. The one thing I want to mention is, like the head of the radius wears a cap, and that's what this is. It's called the capitulum. So at the capitulum, we see that when we take our arm and rotate it, and take our forearm and go back and forth, that rotation happens at the radial humeral joint, and so rotation or pivoting happens here. It's a pivot joint, whereas only flexion and extension occurs at the joint where the humerus and ulnar meet, or the humeral ulnar joint. It's only flexion, but rotation happens at the radius. Let's move our way back down to the wrist. I hope you're close enough that you can see this, but there is kind of like a bony process here on the radius and a bony process here on the ulna. Those are called the styloid bones, or styloid processes. So we have a styloid process on the ulna and a styloid process on the radius. And what they're doing is helping to secure the wrists so your bones don't go back and forth very much. We have 8 bones in the carpals. Most people don't need to know them for lab practicals at the schools I'm at recently, and so I won't bore you with the individuals. But as a group, they're called the carpal bones, and there are 8 of them. We do have 5 metacarpals, starting from the thumb going to the pinky. They are numbered 1, 2, 3, 4, and 5. From most people will see that this is within the hand, and then from the metacarpals out are our fingers. When you look at our fingers, at least 4 of them have 1, 2, 3 bones. So we have a proximal, a middle, and a distal phalange. The thumb only has a proximal and distal phalange, no middle. So you count them again from the thumb out. We have the 1st, 2nd, 3rd, 4th, and 5th proximal phalange. 1st, 2nd, 3rd, 4th, and 5th distal phalange, but only the 2nd, 3rd, 4th, and 5th digits have a middle phalange, as we see here. I believe that is it for the upper extremity.